I was hungry and you fed me. I was thirsty and you gave me drink. I was naked and you clothed me. I was in prison and you visited me. Inasmuch as you've done to one of the least of these, you've done it unto me. Our unsheltered guests, these men and women and families and children need us, and we must care for them.
The importance of Collins Chapel goes back decades. This place allowed African Americans to practice medicine and to be treated when other facilities wouldn't allow them. It's been empty for a couple decades now, and Paul Young and others, we were trying to figure out how could we help the CME Church to revive this facility.
A couple of years passed, we made some minor investments in the property, but after those couple of years, I had a presentation that was actually held by MIFA. And after that presentation, we had a follow-up dialogue with Lisa Anderson and a number of other stakeholders. And so Lisa Anderson said that the best place for her to operate in her mission would be a space like Collins Chapel. And then the bells just went off.
The mission of Room in the Inn is based on hospitality. From the beginning of our existence, we didn't want to duplicate what was being done already. We wanted to fill gaps for services in Memphis. And we identified two. One of them was medically fragile, unsheltered individuals, and the other was families. And our goals were to meet those gaps. Having a space to do that was a challenge.
And when I heard the opportunity to partner with Room in the Inn homeless ministry, I got excited. What should and could Collins Chapel Connection Hospital, resurrected and renovated, do? We could not have a better ministry or partner.
With the CME Church that owns the property, we're able to move into that and have a place for medically fragile, unsheltered individuals, and also for families who are in that rapid rehousing program with MIFA.
Lisa Anderson and Room in the Inn are long-term MIFA partners. And this allows us to place families in clean, safe environments. So it allows a broader base of support for families, and I'm really excited about our new efforts with Lisa, but I'm so thankful that she has been a long-term partner of MIFA.
I'm excited about the opening day, and I'm so thankful for what they will see, a renovated facility, first-class rooms, first-class bathrooms, first-class beds and equipment.
Now we have this magnificent facility that's going to serve people throughout our community, addressing homelessness at a time when they're medically susceptible, when they have been released from the hospital and they're well enough to be out of the hospital beds, but not necessarily well enough to be on the streets.
I am excited that we are creating the first recuperative care center in the Mid-South. On the first floor, we have 21 beds that are recuperative care beds for medically fragile people who are coming out of the hospitals. This is one of our guest rooms. It is a space for people to have an individual, private way to recover from their illness.
When I think about strength of person, I think about the mothers and fathers who walk through these doors needing assistance. When you have a child who doesn't have a uniform to go to school, you don't know where your next meal is coming from. You don't know where you're gonna lay your head. Your lights are out. And they come in, just walking through the doors takes strength. I honestly hope I never have to muster.
Down this hallway will be the family inn, where 14 families will have individual space. There's a children's playroom, an activity area, so it'll be a place for children to just be children. This room is for parents, primarily to have a place to gather together, but also to have an educational space for parenting classes and support groups. This is one of the guest rooms that families will have access to, and private bathrooms, and a place for them just to have some privacy. What I hope for this is that it becomes a place of hospitality that meets their needs, not only right now, but gives them some of the underpinning for what's going to happen in the future.
So I'm thankful for Room at the Inn, for Shelby County, for Paul Young, for the CME Church, for this incredible partnership we have, giving new life to this incredibly historic building, but also providing a service for those who are most in need.
There's so many wonderful people here in Memphis, so many tremendous resources that will join us and help us to make their day one experience excellent, and the day that they leave, that they will be going into a better and brighter future.
Go ahead.
Okay, well, thank you for having me, Kimberly. It's always good to learn from everyone else too. As the video told you, we were able to develop this recuperative care model here in Memphis for the first time. And we are very fortunate to be on this campus of the Collins Chapel Hospital property. We piloted a recuperative care program early in the pandemic as we worked together on this working group of providers and establishing what the gaps were for those who were experiencing homelessness early in the pandemic. Room in the Inn had a goal for the future to open a recuperative care center. And so we took this opportunity to say, we will make that our mission during the pandemic crisis, to work with the hospitals to get those people discharged from the hospital into a safe place for recovery, because hospitals needed those beds to be empty, and people who were experiencing homelessness and were ill needed to be off the street in a safe place. So we did that for several months, and then the opportunity to talk about this property and CARES Act funding that was available came to us. And so we have been here for 6 months now, accepting guests in the recuperative care center. We have 21 beds, and about half of those are able to be filled now. Because of COVID, we are not going to be at capacity for a little bit longer. So that's where we are. We have had many opportunities to work with local medical facilities to accept those guests and offer them a safe place to recover.
Awesome. Thank you, Lisa. I appreciate that. Courtney, can you hear us? Okay, she's still having some challenges. Okay. So Lisa, if you could, I know during that particular time when the video was shot, I think you all were preparing and the construction was going on during that particular time. So you can go ahead and share with everyone that you're now in the building and you're serving individuals, and how many people do you currently have at the facility now?
We have 10 guests right now in the recuperative care center. That I think that's accurate today. Our census obviously changes daily based on the needs in the community. Those people, the conditions of those people range from needing a couple of days to recover from just an event, an illness, to some longer term needs. We have a couple of guests who are in cancer treatment. And obviously, you know, I think that somebody I was touring the building with last week admitted that it had never occurred to them that people who were living on the streets would have to experience that kind of treatment and health care without a roof over their head. So we do have 2 individuals who are in cancer treatment, which really changes everything for them to have a place that they can, one gentleman who goes and experiences pretty intense chemotherapy every few weeks. And the thought that he would be in a place that he couldn't rest, that he couldn't have access to his medications. And also our staff is in contact with his healthcare providers so that we're all working together to make sure that he gets the best care that he can while getting 3 meals a day and a place to shower and really to live in community at a time that he most needs it. So
Awesome.
that's kind of an overview of what's happening here. Many varied stories and different reasons that people come to us.
Awesome. Ms. Courtney, can you hear us? We still having challenges? Think so. Okay. We'll keep moving forward. All right. So Lisa, if you can share with them also, prior to going into rooming the inn, what were you basically doing? How are you working with the homeless population prior to going over to that new facility?
The Room in the Inn's core mission is just very simply to provide emergency shelter. And we do that through area congregations. And we have about 55 partners in different faith communities that provide that shelter. Small numbers of individuals experiencing homelessness who need a place to sleep at night, to get a meal, to have some community. And so it's been very helpful to have those congregations partner with us. And that is where we saw this gap in service for people who were homeless and ill, because they would come to us for shelter for an overnight shelter experience and really needed something much more than that. So beginning next week, we will go back to offering that shelter in congregations. But now we have a model that people who are sick are not going from place to place, but have a secure recovery place.
Awesome. That's fantastic. I know as well, during this particular time, of course, during COVID-19, it has been such a challenge, such a huge challenge for all over, of course, the world, and especially here locally. And so if you could kind of discuss some of those things that you've experienced during this particular time and those health impacts as a result of COVID-19.
Well, the population that we serve were at risk, just like all of us are. So finding ways to help them have access to testing, to have access to vaccinations, to open a new facility in the middle of that and put into place protocols to keep people safe. We have 14 families that we work with MIFA to shelter. And, those families have children. Sometimes we have as many as 30 children in this building. It's exhausting, really. The pandemic has caused us to have to do things that we never imagined having to do to keep people safe. We've been very fortunate to have few cases in the population that we're serving here. But still, it's been a big challenge and still is a challenge to encourage these families to be vaccinated, to help them feel secure in the information and education that they receive. So I think there just have been some challenges that you can't anticipate till you're in the middle of it.
Right. Absolutely. I know that we appreciate our partners that have worked with all of us during this particular time. We see Michael chiming in there, Miss Mary Hamlin. We appreciate her and the whole entire team over there, as well as all of our other partners that we have working with us during this particular time, during this effort. And so as we continue to talk about the health impacts about homelessness and lack of housing, what do you think are some of the best practices for improving that?
Well, I think having a recuperative care center in our city changes the game. We're certainly not able to provide shelter for all of the needs, but I think we're at the beginning of something that will impact this community for a long, long time and grow into programming, maybe not just Room in the Inn, but maybe as we work with healthcare providers, in that there would be more opportunity. For Memphis, I think that we have healthcare providers who understand the needs, but they are in situations where they have limited ability to keep these folks who are uninsured in the hospital. They experience them coming back to the ER very often. And I believe that our primary goal is to provide safety for these individuals, but the outcome of that, the long-term benefit for that is a benefit to the whole community, because the healthcare systems are not taxed the way that we have seen. Emergency rooms are not visited as often, and there's many national studies that show that cities who have respite recuperative care programs have fewer return visits to the ER by those who are homeless, and so that impacts all of us. The need, and we saw that most heavily during COVID-19 surges, that there were no beds in the hospitals for people who had insurance, much less for people who were struggling to find health care wherever they could find it. So I think that what recuperative care does, and what we are hoping to continue to grow here in the city, is it interrupts that cycle. And through building of community, working together for help with health care providers, I think that we can follow these folks into permanent housing and help them to take control of their health care in a way that benefits them for the long term.
Awesome. I know that many people may see homeless individuals on the street, and of course, they're always asking the question of why is it that the city is not doing enough to try to get our homeless clients off the street, and just realizing that we are definitely working, and you all are working, as well as our other partners, Hospitality Hub. They do a lot of street outreach, Catholic Charities as well, and there's so many other partners that work with us on this. And so if you could, in terms of people coming out of the hospital, what is that relationship like for you?
Well, we are every day building new relationships with the providers, the social workers and case managers. They are the frontline people, and the model has changed in healthcare, where medical facilities have learned that it is beneficial to not only the institution, but to the community, to have some case management for people who are in this position, and to do some of that based in the healthcare system itself. And so what we're able to do is to work with them. There is a limited number of places that people can safely go after they leave the hospital, and hospitals can't discharge them to the street, and it's a crisis for them to have an ER full of people and know that you have one or two at a time who are not able to be, they're not sick enough to be in the hospital or not sick enough to stay in the hospital, but they are too ill to be on the street. And so that's what this gap, this recuperative care filling gap does, is to help us to provide for those people. I know people tell me all the time, I've seen people in hospital gowns on the street. And, that's not what we want. And that's not what anybody in the city wants. To have an opportunity to change that picture is really, very humbling to us, but also very exciting to think about what can happen in the future.
Okay, great. If you could, Lisa, just walk us through, if I'm a client coming in, I'm coming from the med, what happens? What's the first step?
The first step is that someone there at Regional 1 would make a referral. We have a process, we have a criteria, and of course, over 6 months, we've learned a lot about that, learned a lot about what we can do and what we can't do, how to have those conversations with providers. And so, the first step is that we have that conversation. Is this person able to be independent? We're not a medical facility. And so they need to be able to, it's a recovery opportunity. They need to be able to take care of themselves to a major degree. So there is a criteria. There are people that are homeless that need to go to skilled nursing facilities or need to go to rehab facilities, and then maybe come here to fully recover from their illness. to get some of those medical resources first. But if they meet the criteria, then the guests come here, and we continue to work with providers as much as we can. But at that point, our staff, our case managers, our staff gets intimately involved in what the plan is for the guests as they recover. We're making sure that they get fed, making sure they have meds, making sure they get some exercise and have community involvement, but also setting some goals with them. What is the thing that you want to do next? When you leave here, what is it that you want to happen? And our goal is that people leave us and go into permanent housing, because that's really, that solves a lot of their healthcare needs, because if they continue to go from shelter to shelter, and they already have chronic illnesses that are going to be part of their lives forever, going from shelter to shelter, living on the street, being in large communities of people who also are experiencing some of those things, communicable diseases, that's not ideal for them. So what is best for their health care, the best for their long-term health, is to go into housing. And so that's our goal.
Okay. Well, great. What are some of those challenges, Lisa? I know you have been operating for how long now? Since
About 6 months.
Yeah, about 6 months. And so what are some of those challenges that you've seen?
I think finding landlords who understand what we're doing, who will work with what we're doing. We're meeting a lot of really good people who want to be part of this, but it is still building bridges between what we're doing and those landlords. That's the biggest challenge, is finding safe, affordable housing for people whose resources are very, very limited, and who have histories of all of the things that we have talked about before, the evictions and utility issues and all of those things, trying to work while they're with us to establish some goals and solutions to those things. So I think that finding the housing, the permanent housing, is a frustration.
Mhm.
Also, navigating the complex healthcare needs that these people have,
Mhm.
because it's not like me having an appendectomy and going home and getting better. There's usually complications that go with that. So we've had people who come to us who are sight impaired, or who or amputees, who, so it's not find just a place, it's find the right place for them to leave here to live in. So those are the challenges that we're facing every day. Moving people from being homeless to having a home of their own, but also taking into consideration a very complex health condition.
Okay. So what has been your success rate, if you will, in terms of those individuals going into their own permanent housing so far?
Yeah, we, our data is very, very new, and so it's hard to give a lot of percentages.
Mhm.
But what I can say is that we have, between the families that have been staying here and the recuperative care center, we have seen 25 families, units, individuals, 25 go into permanent housing in those 6 months, which is pretty incredible, I think, and has motivated us to take the next step. As we have worked with these folks, we've realized that getting into housing is not the end of what is needed or required. Everyone has complicated situations. So we've created a housing stabilization program that is brand new for us. And in the future, I think that will make all the difference, to use volunteers to walk alongside people who are getting housing, sometimes for the first time in a long time, and building those skills that they need to maintain that. Just kind of some, walk alongside people so that they have encouragement to maintain that housing once they're there. So housing stabilization is also a challenge, but one that we have dedicated time to and created as part of our program.
Wonderful, wonderful. What would you say if you had to create your perfect scenario? I know we love those. Your perfect scenario where you had everything that you needed. What would one or two of those items be to make things better for you?
I think that we're realizing how intense the work is, and we are minimally staffed because we went from a seasonal shelter program with at the most 4 employees at a time to having 23 employees to be minimally staffed. So I think staffing is always a challenge, and having enough people to be able to spend the time that is required with the individuals that are staying here, families who have complicated lives, these people with complicated health problems. It takes a lot of time, a lot of case management, a lot of encouragement, a lot of education. And that's just between our staff and the guest. There's also a whole other layer of people that are being interacted with, healthcare providers and insurance companies. And so I think for our guests to have more people available to do that work is a goal, to do fundraising and write grants and to have more staff. I think that also, a goal for us is to continue to build our programming so that people are getting the education about taking care of financial issues, legal issues, parenting, how to advocate for themselves in healthcare settings. So, those are the ideals that we're setting up for ourselves now for the future.
Awesome. You mentioned healthcare. Do you have a partnership with anybody right now?
We have an MOU with Christ Community Healthcare as our healthcare partner. And as we get back into a more normal time, we would anticipate that their mobile clinic will be available to our guests. And they are also, a wonderful resource for us when we need them.
Oh, well, awesome. We definitely need all of those partners. And I know during this time of COVID, so many individuals and partners have stepped up to the plate to really help us out during this particular time. And so we greatly appreciate that. So Ms. Courtney, we're going to jump to you. Can you hear us?
Yeah, I can actually hear you and see y'all. I don't know what y'all have been talking about this whole time, but I'm sure it's been
Oh,
good.
it's all good stuff. I promise you. Well, we are so glad you're able to get in on this conversation that we're having. Of course, if you could go ahead and introduce yourself to this session and just basically what you're doing currently right now.
Okay, so my name is Courtney Melton Fant, and I'm an assistant professor at the University of Memphis in the School of Public Health. So my research is really at the intersection of state and local policy and public health. I'm kind of looking at how those produce health outcomes and then what we can do policy-wise to improve health outcomes. And I have an interest in housing policy and have done some work around looking at kind of the distribution of evictions in Memphis and how that relates to mental health at kind of the neighborhood level.
Oh, well, awesome. So currently, what are there any special projects that you're working on related to all of that?
Yeah, so I just finished up a study with a couple other people, like I said, looking at evictions in Memphis and this is pre-COVID. And what we really found is that eviction filings are very concentrated in our majority Black neighborhoods. And then also in majority Black neighborhoods, as the kind of prevalence and rate of eviction filings go up, we're seeing poor mental health outcomes. And so kind of the interesting thing was that because it was at the population level, that means that even if you are not personally affected by an eviction filing or a judgment against you, just living in a neighborhood with that type of thing going on is detrimental to people's mental health. And so really kind of just the effects of different types of housing instability is not limited just to the families that are going through it, but the larger community, and those effects spill over.
Okay. I know you mentioned that it's happening more prevalent in the Black community, and is that also associated with poverty?
It's independent of poverty.
Oh, okay. Okay.
And so, because obviously, with housing, there's government involved, then there's
Hmm.
also the private market, and developers and a lot of players involved. And
Hmm.
so, the way that developers and landlords, the research looks like the way that they kind of behave in majority Black neighborhoods is different than other neighborhoods. So it's not just what we're seeing in majority Black neighborhoods is not just poverty, but it's larger kind of systemic discrimination issues in the private housing market and investments that flow in and out of neighborhoods.
Oh, that's really interesting. Can you dive a little deeper into that for me, in terms of some information related to that, and why is that the case? Why do you think that's the case?
It's really, I think anytime we're looking at kind of present day conditions
Hmm.
we're looking at history and what's come before and kind of shaping what we have now. And so it's not just policies that have happened now, even if we look at, because I think we all know that Memphis is pretty segregated, but that is kind of based on a history of kind of policy, even if we go all the way back to the New Deal, and where we were providing kind of incentives for people to buy homes and mortgages, and they were incentivizing them to kind of in the suburbs, and then providing those incentives to white families to kind of become the middle class was really created, and then denying that to Black people and other people of color. And so what we have is neighborhoods that are already racially segregated, kind of based on policy, and then some groups being able to own homes and other groups not. And so then if we look at kind of what looks risky for developers or where they want to invest, they're not wanting to invest in those already segregated neighborhoods. And there is investment in the suburbs and kind of in Memphis, we have a lot of, Memphis is very large for our actual population. And so you see different kind of investment patterns. And so it was a mixture of public policy and then private investment kind of created the segregation that we have. And so then we have kind of landlords now where the properties that are available, they might come into majority Black neighborhoods and the conditions that they're offering on the rent or the contracts are more predatory than they would. And so those people end up just kind of being more vulnerable and having kind of worse choices. And so we're kind of seeing it play out in real time. And then what we're trying to do now is really kind of fix everything that's happened before. But the cycle has been perpetuating for decades and decades.
Wow. That's very interesting. I know that, of course, during COVID-19, that doesn't make things even better. We've really seen an increase in the rise in those evictions that are happening during this time. And I know that we have a lot of money out there for rental assistance and utility assistance, but the challenges are still there. So if you could, Courtney, if you can talk about those health outcomes as a result of housing instability.
So with housing instability in general, it comes in a lot of different forms, but it could be evictions, it could be you had to move involuntarily because the rent was too high. It could be how we kind of redeveloped our public housing. And so all of those people, that's a form of instability because they had to leave their communities to go somewhere else. And so that creates mental stress for people. It's been associated with kind of with higher blood pressure, with worse physical health outcomes. Children and adolescents are very vulnerable to the instability, and so it affects their ability to kind of learn in school. It disrupts their education, and then the sense of community that people have and that social connectedness that kind of disappears when people have to involuntarily move. And so it's been looked at in the short term, and then even talking 2 or 3 up to 8 years later, what we've seen in the research that people are still having these negative kind of health outcomes. And I think with COVID is interesting because people were affected whether or not they had COVID. So it was a community, kind of a community health crisis. So some people's jobs were closed down because we were trying to deal with a community issue. And so if you lose your job, you don't have an ability to pay rent. You could, get behind and the landlord can evict you. And so even the health status of your community, not just your personal health challenges, is related to your housing stability.
Okay. So what do you think are some best practices out there on improving this issue?
I mean, obviously, it's challenging. An interesting thing that cities have been doing is they've actually been buying up, kind of trying to compete with the developers, and so buying up apartments or multifamily kind of housing facilities, and using those for affordable housing units. Obviously, it's challenging because cities have different kind of fiscal resources and you're cash strapped. No one's sitting on a pile of money to just come, buy up buildings. Also, I think what they're kind of doing in Binghamton with the community land trust, that's a promising practice that has worked in other places. So I'm looking forward to kind of seeing what they're doing here. Also, there's different kind of things we can do. I mean, some of it is included in that Memphis 3.0 plan, but kind of how we're zoning. So if you look at neighborhoods right now, a lot of them, they're only single family homes, but kind of changing our zoning so we can build more multifamily housing units that are affordable and can house more people. And so there's zoning reform. I know the city's kind of using some of the CARES Act money that's coming because the housing situation is not just a function of kind of what the city is doing, but it's private, the federal government, state government. And so there's limits to what the city can do, on their own. And so it's a all hands on deck type of thing.
Okay. I know that that's a huge challenge, and I know on the homeless side of things, and for us in my department alone, just the cry that we hear from a lot of our partners is, the lack of landlords that will work with our citizens and work with our clients, trying to get them into housing. And so, part of the challenge that we have in the city is safe, affordable housing. It's not the lack of housing. We have a lot of housing here, but it's the best safe and affordable form of housing that we really need. And so, I know you talked about some of those best practices. What do you all think are some of the projects that are underway here in Memphis? I know I can mention a couple, but that will hopefully help us with this particular effort. Either one, Lisa or Courtney.
Lisa, you can go. You might know more than I do about this one.
Well, we have just really tried to start being very creative in talking to people, initiating new conversations with landlords that may not have ever taken this chance before. And I think because we are interested now in this housing stabilization, part of what we do, that landlords feel a little more comfortable with taking that chance. There are people in the city who are building smaller houses, that are individual houses, but they're smaller, and that's ideal for the people that are leaving our facility. And we have someone moving into one of those small houses very soon, in the next few days, really, probably. And I think one of the challenges for us is for this recuperative care model is the people that we need to move into permanent housing don't need the responsibility of a place that requires upkeep, a place that even that is has a lot of other residents there because of their healthcare problems. So we're looking at smaller house models, at places that have never tried to work with this population before, and hoping that we can encourage them to work with us that way. So that's what we're seeing, especially with those people who have healthcare problems, is that sometimes it might be easy to get them into a rooming house that week. But because of their healthcare needs, that's not what is ideal. It could, that would be the easy way, but it wouldn't last because there are so many healthcare issues that come along with living in that kind of environment. So that's what we're working on, is really looking and trying to be creative, talking to anybody that will talk to us about it, and have developed some new relationships with new landlords.
Oh, that's great. I know that Hospitality Hub, hopefully they're on. They are working on their new facility over off of Washington. And so we're so excited about that. We can't wait for that to be completed. They'll be adding like a day center as well as some new beds for single women. And so that will be coming soon. And I know that there are talks and conversations about them building some tiny houses as well to address what you were just talking about, Lisa. And so those are some of the projects that are going on. Of course, we have our wonderful partner, Memphis Union Mission, that has their beautiful new facility over there located off of Poplar there. And I'm not sure if they're open just yet. Their new facility is open, but I got a chance to go and look at their building. It's awesome. Beautiful facility, state of the art facility for our homeless single men there. And so we're excited about that in terms of addressing those health impacts that are going on here in the city. And so those are a couple of the items that I'm familiar with that we're working on. Of course, our partners, we continue to move forward with any new ideas that are out there as we move forward, especially with all the CARES Act money that's out here right now, trying to make sure that we address those needs. And so that's what we're working on. So if there are any questions at this time, if you all can go ahead and submit those in the chat, and we'll make sure that we try to address those as quickly as we can. And also, Ms. Courtney, if you could, I know we talked briefly about, of course, the health outcomes that are happening. And so futuristically, if you were able to have your crystal ball and to set things up, what would that look like in Courtney's perfect world in terms of the health impacts and how to address it?
I mean, one, I think I would like to see kind of healthcare, public health, and housing and city planning, like all working together in developing. I guess when we're developing things like any housing policy, that is a health policy. And to kind of examine those effects from the outset and kind of be more intentional about how we're planning. I would like to, I guess in my magic ball, I guess get away from so much single family zoning for just these traditional single family homes with these minimum lot sizes, because that density is kind of more the way to go. And then everyone doesn't have the same needs, like particularly with the population that Lisa was talking about. They don't need all that space and to maintain that. I think also too is I would just like to see people's wages come up, because that's part of housing too, is just being able to afford it. And there's people losing their housing because rent is going up more than their wages are, and the wages are stagnant, and that's affecting the housing market. And I guess the last thing is I would like to keep these big investors from kind of buying up all these properties, because it's hard to, we can't compete with Wells Fargo and them buying up and charging what they want. And it's a lot harder to deal with the corporate landlord than with an individual kind of mom and pop. So those are things that I would like to see.
Oh, wonderful. Those are some awesome suggestions. I know that hopefully, once we finish with this and we move forward in our planning of future projects, that will be considered. We'll definitely make sure we have that information at the table on the front end for sure. That would be awesome. And so how do you think that you should navigate that in terms of, would you be a partner on the planning committee, or would you like to have a discussion? How would that happen for you?
Like me personally?
Mm-hmm.
I mean, I know what I know and I know what I don't know, but I
Right.
think if we're all in the room together, or
Mhm.
just even, I mean, I don't know.
Okay.
I don't know. And I think a lot of, this is my first time kind of hearing a lot of the work that Lisa's in Room in the Inn is doing,
Mhm.
but even kind of having that stuff and evaluating the impacts, and when we're trying to talk to other people and get them to buy in, saying, look, this is what we've done, these are the outcomes, that's a lot more compelling than, because this is the right thing to do. Because that's not how a lot of people are moved, by doing the right thing. So I even think it's small things, I guess, kind of like that.
Okay. Okay. That's good. I know with the partnership, of course, now with sometimes what ends up happening is that we tell people we're doing a lot in the community, and they're just not familiar with all of the work that we're doing in the city in terms of helping our homeless population. And I know that communication is key, just making sure everybody's informed of what we're doing and that we exist. And so that's something that we will definitely try to do a better job of making sure that we communicate those efforts and what we're doing here to work with our population. One thing that I will additionally share while we wait on the questions to come in is that a lot of people feel like we're, I mentioned to Lisa that we're not doing enough. And why is it that I see homeless people on the street and the city is not doing enough? And what I have to tell everybody is that we cannot make anybody do anything. They have to voluntarily come off the street unless they're causing harm to themselves or someone else. And so it's not that we're not reaching out to them. You just have to keep working, keep developing that relationship with the homeless clients that are out there in hopes that they would, one day want to come off the street. And so just want to put that plug there for everyone so they'll be understanding a little bit better of how that actually works. And it's not that people are not trying. It's just that it's a choice. It's a choice for them. And a lot of our clients are dealing with mental illness, mental challenges, as well as A&D issues. And we have to work through some of those things as well and to get them off the street. But we have some awesome partners that are working with us, some of which we're funding. And they're doing some great work in the community. So we're so grateful for them. So I did want to share that. So I don't see any additional questions. Anyone? Are there any items? Lisa, anything you want to share before we wrap up? We got a few more minutes.
Just from what you were just saying, I think that if I had a wish, it would be that we would stop being reactionary with this population. Right. And that we would, when Courtney talks about let's really look at what works and make the policy fit that instead of trying to do it the opposite way, which just seems to be what we normally do. So, if we could start thinking about this in terms of, we know this is going to impact this in a positive way, and let's start there instead of reacting to something that is a crisis. And I think we've learned so much this last year and a half about the needs. And I think that going forward, that can be a benefit to us because we've had to make some changes in how we look at this population and how we serve the population and how we allocate funding for it. And so I think that, not being so reactionary, but really planning. And that's been one of the beauties of this group talking together regularly about, that COVID brought us together, but we continue to talk now about solutions. And I think that's making a difference instead of just creating a conversation around crisis.
I think that's a very great point. And I know sometimes it's very difficult and challenging to come up with things, on the fly and try to deal with certain issues when they happen. Gosh, COVID has taught us so much. When this first happened, we were scrambling, trying to see what we could do to try to help as many people as we could. And people really came together during that time, people that don't normally work together normally. And that has been such a blessing to make sure that we take care of our homeless clients. And those relationships have continued, which is awesome. Sometimes things fall out after, the initial rush is over. And then we have to deal with maintaining level of what we're dealing with. And so our partners have continued to be there with us and work with us currently, as well as Ms. Lisa. She's on the board working with us as well. And so, Ms. Courtney, we look forward to our continued relationship with you as well, because you have provided some great feedback and some great information that I know that would be very beneficial, especially for new projects going forward. And so we definitely look forward to working with you in the future. So you have any final comments or anything you would like to share?
No, I'm glad I finally got in here. So it was nice. The session was nice.
Wonderful. Okay. All right. Let's see. We have a question that says, what are the next steps? For example, when might city leaders and community stakeholders further discuss how to address the issue of housing and struggling individuals and families? Gosh, that's a loaded question. So I think in terms of where do we go from here, and I know that's always area of concern for a lot of people whenever we have these sessions or these summits. And it's just not about talking about what we're doing or what we would like to do, but we will definitely put some legs to it and make sure that we make some efforts going forward, Ms. Mitchell, to make sure that all of those things are addressed. So that's probably my broadest answer to that question, unless you ladies have something better.
No, that's a great question.
And so that's what we'll work on. And so I think we're finished, ladies. So thank you all so much for joining us this morning. And I hope that this session has been very beneficial to everyone that has been listening today. And so we wish you well and take care.